Good morning, viewers. How are you today? I'm glad to have you today also during our session. We covered community diagnosis, all the steps and everything we needed to know. Now we are going to school health program, which is very, very important in community health. We cannot forget the schools. So we are starting now a unit on school health program. Our unit objectives include able to describe how to organize a school health program. We need to state the objectives of a school health program and also need to explain how to plan and implement school health services. Also, we need to state the activities undertaken during a school health program, and then finally, remember, we have to evaluate everything we do in community health. School health, what is it? School health program is, as I say, is an integral part of community health. It focuses on ensuring health promotion, conservation, protection, and correction of abnormalities of the school population. So why do we have school health program? The aims of school health program. It is to promote and maintain the health of school children, promote positive health behavior among staff and pupils, bringing up citizens who understand basic good health habits, and ensuring general community health. You know, through children, especially primary school children, the pupils, when you teach them something, they'll go back to the community and tell them, Mommy, Daddy, Auntie, this is what you are taught. What you are doing is not right. So they have the power to change the community. That's why they are very good entrance for us to change the community. So we also need to improve the physical and social environment of the school. It's very, very important. And also under school health program, we provide the following. Primary prevention, that is now teaching them about balanced diet, teaching them about how to go about prevention of accidents. We are preventing an accident from happening. That's primary. And then you have secondary prevention, where we diagnose and treat conditions. Maybe you might find the school children have ringworms. So you diagnose and treat. Maybe they're having flu, such kind of thing. Like now, when we go out for school health program, we identify even early symptoms of coronavirus. Then we do the necessary. That is secondary prevention. So you diagnose and treat. And then you have tertiary prevention. There's a problem already. Maybe there's a child who is physically enabled, maybe deaf or blind. And probably the parents have not known this, or they are not sure of what to do. So we enroll them in a rehabilitation center, or we take them to a school where they are going to gain knowledge and also interact with others so that they may learn effectively. Or a child could be having another permanent problem, so we take them to a center where they can be helped to improve their status. So for a school health program, there must be a committee or a team. And this team has teachers, pupils, parents, or formal and informal leaders, like the village elder, maybe clan elder, and then we must have a community health nurse because it is a health program. So we need to have a community health nurse in this team to give advice, to counsel, to guide on how to go about the program, and also interpret the findings during the school health program. So before we go into the activities of a school health program, let us look at the needs of a school child, a pupil. What is their need? Because we may find some children coming to school, but they're having some difficulties in some areas. One of the needs is a stable home, because a stable home provides basic needs of a school child. And security also. A child who has come from an unstable home, they usually have problems, even in learning. So the earlier we identify this, the better for the learning of the child. Proper nutrition. These children are still growing. They need to eat well, a balanced diet, so that they may grow physically, mentally, and socially. So they need to take adequate nutrition, balanced diet, and extra proteins and vitamins because they are still growing. Proteins are good in bodybuilding, and vitamins to prevent diseases. So when the child is well fed, they'll be able to cope with the school life and meet the needs. These means may be provided at home, at school. If the school is very far, maybe they could be having a school feeding program, or the child may be packed some food to eat. You know, children are not like adults. They cannot take exactly 3 meals with that duration. So they can be given something to eat, a snack in between. Another need of a school child is freedom from fatigue. A child needs enough rest. They play, they do this, mental activities, classwork, so they must be supported to rest. So when the child comes home, they need to take a bath, eat their supper early, and then they rest in time. Actually, we are advised by psychologists not to wake up a child to eat. If the child has slept, let them sleep. Because when you interfere with the sleep of the child, it interferes also with their growth. So it's good that they be fed early enough so that by the time they're sleeping, they are okay. They can sleep until morning. They also need clothing. Yeah, children should have adequate clothes. Like now in a school, when you go to a school, and for us, we usually deal with primary schools. You check the clothing. You expect them to be having uniforms. How clean is the cloth? How tidy is the child in the cloth? Are they wearing shoes? Because there are some conditions, community health conditions, that are preventable by the child wearing shoes. And also the shoes prevent them from injuries, like accidents, hitting their nails, their toes, and all that. Another need of a school child is good sight, hearing, and speech. A child who cannot see well, a child who cannot hear well, a child who cannot communicate, they're always frustrated in the school. So one, they need to be able to learn well, and because of that frustration, they may have challenges even in future. So some of these disabilities, as I said earlier, they may not be recognized by the teachers because they have not been trained to do that. But us as healthcare providers, when we go to them, we look at them, we interact with them, we may realize some of these problems, and then we refer them appropriately. Children also need freedom from infection. The children should eat well, vitamin-rich foods rich in vitamins. They need to be immunized against immunizable diseases, BCG, polio, all that. And as healthcare providers, we can tell whether these children have been immunized and if there is a need of doing some additional immunization. These should be treated from common conditions, common cold, sore throat, skin rashes, such kind of things, ringworms I mentioned earlier. So once they have been identified, they are treated. And those things that cannot be treated at the school level, they are referred to the health facility. Another need of a school child is pure and safe water. This should be provided at school and also at home to prevent them from related diseases. We call them waterborne diseases. They also need adequate sanitation. Where will this child go? The toilet. Are they using the bush, which is very dangerous? There are diseases that are transmitted because of us passing urine anywhere, passing feces anywhere. So we need to properly dispose the excreta and also the refuse, the dirt, the papers around the school, the dirt around the school, they need to be well disposed. They also need clean buildings at home and in the school. So when you go out to the school, are the buildings clean? Are they safe for the children to learn in? Are they stable? So those are the needs of a school child. And remember I said we deal with primary pupils, not secondary, because those who are young are easier to teach healthful habits. Samaki mkunje, angali mdogo. So activities undertaken in school health program. We carry out observation. We do screening, physical examination, and other investigations like stool tests. We can do. Yes, viewers, now we are looking at activities. We shall continue from there. So I talked about observation, screening, physical examination, and other investigations like stool tests, urine tests, and all that. We also give emergency services. Maybe the child is in need. We are there in the school. A child faints, we give emergency services. And also they might be ill, maybe a chronic condition. We can continue with managing the condition. We also do counseling. Those are one of the activities undertaken in the school during school health program. You can counsel pupils, counsel teachers, or any other person within that school environment. You also need to involve parents. If there are issues that require parental teaching, parents need to understand more, they need more knowledge, because from the pupils we can tell if there's knowledge gap. We can also look for the parents, book an appointment with them, and teach them and tell them more. So also parents are involved in planning and conducting healthcare activities. Remember in the committee I mentioned parents. A parent must be represented there. So because we need to work with them during this program. Pupils, don't forget pupils. They are our key people in school health program. And remember what I said, samaki mkunje bado angali mdogo na uangalie awe mbichi. Kama amekaushwa ile mmekausha kwa jua ama mmefanya deep frying, hawezi ukamkunja. Another activity, also we need to contribute in the curriculum development of the schools, health related topics, because even there they learn science, so then it needs to be relevant. We need to consult with the teachers and personnel. And then they also under curriculum, I've just remembered, they can deal with issues of being scouts. They learn first aid. Remember those things? They learn them. So within that, pupils are well prepared to handle that. And then another area we need to look into, where do we refer the pupils for treatment? We need to understand that we are going for this school health program, and in case the pupils need support, where do we refer them to? It is very, very important. So we need to have health facilities within that area. Depending on the need, you can refer them to level 1, those are dispensaries. You can refer them to level 4, those are bigger facilities, or where applicable. That's why we need a community health nurse who understands the right places to refer these pupils. And don't forget even to handle their teachers. They may be having issues they need to discuss with you as a healthcare provider. Talk to them, don't ignore. Maybe they also have cooks in the school. Talk to them, listen to them, teach them, give them health messages and all that. And we also give health messages, another activity, very key. We give health messages on relevant topics like balanced diet, hygiene, also on sexuality. You can give health messages on first aid, how to prevent accidents, how to handle minor accidents. It is very key in school health program. Health messages are very, very important. So after doing all that, doing inspection, we shall look into them in details. You have carried out observation. You have done screening, physical examination of the pupils. You have identified, you have diagnosed some conditions. You have treated them, or referred. You need to teach them also on other health care areas, on how to prevent, how to promote, and how to handle in case of accidents or any other thing that may happen in the school. Now we want to plan for school health services. So first, you need to carry out a health assessment survey. Assess the health needs of the school. What do they need? And this one, we can do them from clinic records. The schools, where schools are, there are health facilities around that area. Even a dispensary, level 1, they handle people from that school. Even the community from that area. You can go to their records and find out what are the needs of this area. The under 18 or under 15, the under 5s, which common conditions are they treated for? Because that will give you an idea of your area of emphasis. If many of them come to the health facility because of diarrheal diseases, that tells you need to give a health message on prevention of diarrheal diseases and many others. Reports. You can also access reports from the sub-county health officers. They will tell you this region has this kind of challenge, and then you can also see how to plan for the school health service. You can also talk with health team workers. They know what's going on in that area, so they can also advise you further. Well and good if you are a worker in that health facility near that school. You have access to many reports. You have access to many information, a lot of information from different types of people. Also talk to teachers and the pupils. What are their challenges? Which areas do they need information concerning health? Which areas do they need support, so that you can also plan on tackling those areas? Personal observations and experiences. I talked about maybe your community health nurse working in that region. So from your experience, what could be their needs? Personal observations. You walk around, you interact with them, you meet with them in their church, you meet with them during baraza. What could be their need? You can also talk to formal and informal leaders, village elders, clan elders, the chiefs, the assistant chiefs. They'll also give you a lot of information concerning their community, especially dealing with pupils. Now, we are planning. After you have planned, you have done your health survey, the baseline survey, you need to have the following resources for you to carry out a school health program effectively. Finances. Finances are very important because even for you to go there, for you to get your drugs, transport, people who are going to support you, maybe subsistence cost, lunches and all that. So you need to have finances. You need to plan and budget. So when we talk about finances, it is budgeting, in other words. Budget for the program and have your resources of that budget. This money will come from county, this one will come from where, and also involve the community. They may contribute because sharing is very, very important in community health. We want them to own the process so that when you go back to them, they remember, yes, I participated in this, we contributed this for the water tank, I contributed this and that. So remember to involve the community. And one way of involving them is cost sharing after assessing their level of ability. Materials, we need materials. You need to be guided by the policies of school health program. You need guidance and training materials because you're going to carry out health education. You may be asked to train even teachers. So you need to have these guidelines on how to train them. You need to have drugs, those are materials for minor treatment of minor illnesses. You may need to have vaccines for those who need to be vaccinated. You need other supplies, stationery and all that. And also you need means of transport to reach that place. Other materials may need tables, may need tents for you to carry out the program. And then time, our final resource, time. Time is everything. That's why planning is very important. You need to plan with your time. Plan with those who are going to work with. Plan with the driver who is going to take you there. Because everybody is busy and we have things to do. So time is very important. Even the teachers, they need to know that you are coming at such a time. So they may allow you to carry out the school health program, and then they also notify the pupils. We're not to be having our regular lessons because there's a health team coming here to look at how we are doing. They will teach us, and also we're also going to learn from them. So time is very, very important. Another resource is pupil. I mentioned pupils must be aware. You know, they are our target. So they must be prepared, they must be aware, and we expect them to participate. You cannot go for school health program and the pupils are on holiday. What are you doing there? You're not only interested in the buildings. Pupils are our main target. So pupils are a very important resource in school health program. So they must be involved, they must participate, and be very active in the whole process. So health promotion aimed at the pupils, it will reach their parents, teachers will also be there, is very, very, very important. And remember what I said, children are very good in disseminating information. So involve them, teach them according to their level of understanding. Because once a child has that right health information, they will practice it, they will go and change even their homes, the way they do things. So they will grow up with the right knowledge, attitude, values, and skills needed to adopt healthy lifestyles to support health. And after everything else has been done and said, the community will be healthy, hence the country will be healthy. Thank you for watching up to the end. That's all for today. We shall continue in the next session, still under school health program. Bye.